everybody, my name is Dr. Vince Gutierrez. I'm a physical therapist. You can find me at movementthinker.org. Let me start off by saying this was brought to my attention recently. I have absolutely zero to sell. So, I like that. Zero to sell. And so, if you go to my website, I'm not selling you anything. If you listen to these videos, you'll see I have no products. I'm not trying to sell you a consultation. I'm not trying to sell you anything. This is all purely for your information only. And speaking of that, these videos are just for educational purposes only. I should have said that for the first two videos, but these videos are just for educational purposes only. Don't use this in place of treatment. Go see somebody who can actually evaluate you. Moving on, in the first two videos, we covered where do you work, what do you do, what is your leisure, what are your symptoms, how long have they been present. All right, next, we want to cover the next question is, over the course of a certain period of time, would you say that your symptoms are improving, worsening, or staying the same? And this gives us some valuable information, right? Because if your symptoms started 4 weeks ago and you're improving over the course of the past 4 weeks, do you really need therapy? Are you only in therapy because somebody told you that you should go? And if the answer to that is yes, give it a couple more weeks. And if you're still improving, give it a couple more weeks. Don't give the credit to me for something that's getting better because of time, right? I mean, time is always a possibility to improve you, but when you stop making that improvement, then come on in, right? So are you getting better, worse, or staying the same? And patients that are getting better or worse, I usually ask them what makes you say that. And what I'm looking for is either the frequency of their symptoms have changed, the intensity of their symptoms have changed, or some version of their function has changed. For instance, they're losing the ability to walk, they're losing the ability to bend, their sleep is not as good, their pain is higher during the day, it's more frequent during the day. And so those are the types of things that I'm looking for, so I can go back and ask these questions again in a couple of weeks to see if we're making any progress. Next, now that we know where your symptoms are at, how long they've been there, and whether they're getting better or worse, what do you think caused your symptoms? Right, and I'll typically ask it, did anything happen to create these symptoms? And a lot of back pain that I see in the clinic, nothing major happened, right? No boulders fell on anybody. Nobody fell in a 30-foot hole. It's, I don't know, I woke up one day and I had back pain. Or, I don't know, I bent over to flush the toilet and I had back pain. Both of those literally, they're true cases. Another one, I don't know, I got in the car and as soon as I got in the car, I had back pain. It's like, these are real cases, There's some research out there to show for disc issues, there's no one single traumatic event that typically causes these problems. It's typically something that's going over the course of time, right? And so usually there isn't the one event. There's no major accident that happens with most people. But if there is, then it needs to be looked at, right? We need to understand, should I be requesting an x-ray or an MRI or what have you? Are there any major red flags there that I need to look at? Which will be covered in another video later. If I'm going too fast, watch again, all right? Because I'm not slowing down. So next, did anything significantly cause your symptoms, or did they come on for no apparent reason? Next, are your symptoms constant, or do they come and go? And that's really important for us, because if your symptoms are constant, that rules in maybe an inflammatory component, right? Some chemical version that's causing your pain, and we have to keep that in the back of our head, because if there's a chemical thing causing your pain, physical movement may not be the answer, right? A chemical cause needs a chemical solution, a physical cause needs a physical solution, right? I keep it very simple, right? It's very dumbed down. And a lot of this I've learned through the McKenzie method, but it's you dumb it down as best as you can for me to understand it, so it's easy for me to teach everybody else, right? Chemical cause, chemical solution. Physical cause, physical solution. A chemical solution won't help a physical cause. A physical solution won't typically help a chemical cause. So we have to keep that in mind. If your symptoms are always there, do they go up and down in intensity during your day? The good thing is if your symptoms aren't always there, awesome. It's like, boom, you're starting to feed me a little bit of information that I can use. It almost, gosh, you ever go to a psychic, and you start feeding them a couple of lines and then they run with it. Okay, I've been to a couple palm readers, but that's okay. And you start feeding them a couple of lines and they run with it. if you start feeding us things that turn off your symptoms, and then later during the evaluation we magically find positions that turn off your symptoms, you kind of gave us the answer, right? And part of what we do is to play the role of MacGyver or Monk, you know, and solve the puzzle. But you're giving us all of the pieces that we need in order to solve this puzzle. And so if your symptoms are intermittent and they come and go, then I'm specifically going to ask, do you know any positions, or do you know what causes them to turn on or to turn off? And even though that's a separate section of our evaluation, I want to touch on that immediately, because for me, that's huge. If the patient understands their triggers, then I know what they need to minimize over the next few weeks. If they know what turns their symptoms off, well then, awesome, go forth and do, you know, and I'll come back in when I need to problem solve again. And so these are all important questions that we're going to ask on the first day when you come into physical therapy. And again, if your therapist is not asking you all of these questions, why are you there? You're not just there to be popped or cracked or massaged or stimulated or ultrasounded or hot packed or cold packed or bird dogged or belly pulled in towards your stomach. I don't do any of that stuff. But you're not just there for that, right? There has to be some sort of figuring out that's done by the professional with the patient. Anyway, thanks for watching this video. I don't even remember which video I'm on now, but come back later to watch the rest.